I'm Josias. I'm from City College Nursing Program. It's part of our community project. We're doing a presentation on UTI, and I want to start the discussion by giving the introduction for UTI. UTI is the most prevalent infection among hospital setup. It's one of the reasons for prolonged hospital stay and a lot of expense for patients' cost. It's caused by organisms. Bacteria are the commonest one, but you can see it also viruses, parasites, and fungi is common. The commonest bacteria causing urinary tract infection is in Escherichia coli, but it can also be caused by other bacteria, which is Proteus mirabilis. Viruses like arboviruses and herpes can also cause urinary tract infection. Parasites like schistosomiasis, Trichomonas vaginalis can also cause urinary tract infection. The risk factors, particularly, our discussion is on the association between urinary tract infection and old people, and why are old people having a tendency to develop urinary tract infection. There are risk factors linked with that. For one thing, older people, their immunity is very low. The other thing, they have a comorbid condition that can expose them for a lot of infections. Some of them, they have a chronic catheterization situations whereby they kept their catheter for a long period of time. There's a polypharmacy also. They may be taking some medication that are interfering with their immune system that will expose them for infection. Because the anatomy problem that we have as old age goes, as old age comes, they have a difficulty of completing their urine. That incomplete clearing of the bladder can become an aggravate for bacteria and germs to grow. And the other thing is the clinical manifestations of urinary tract infection. The clinical manifestation, the commonest one will be dysuria, but before it becomes clearly a bit dysuria, you can have fever, headache, nausea, vomiting, chills, and malaise. But finally, you have dysuria, and the color of the urine could be changed into a cloudy, foul-smelling one. Laboratory tests that are done for a patient who comes with urinary tract infection include CBC with differential and ESR urinary analysis to see different types of, it could be bacteria, it could be pus. And the other thing is the treatment. The treatment most of the time is antibiotic. The antibiotic commonly used is nitrofurantoin, but ceftriaxone and Bactrim can also be used. Thank you.
Hello, my name is Nathaniel Gobia, and today I'm going to be talking about the immobility and also the loss of balance in older adults. It's very important to know this because, as we're growing up, as we're aging, we don't really think about a balance. We don't think about immobility, but as you get older, as you're aging, everything starts decreasing. And one of the big factors is you get this decreased function, and that's pretty much like the ability to move around and do things. Maybe they might be able to do, the easy ADLs that they're doing, the assisted daily livings and all that, but at the means, usually they can't. So you also have decreased mobility, like I stated with the functioning, like they're not really moving around, they're not doing things. So this will lead to the reduced bladder sensation. So the urine is just pretty much just sitting in there because you're not really moving. So the urine sits in your bladder for a long period of time, and as it's accumulating, you start getting bacterial growth. And when there's a lot of it, that's when you develop a UTI. And it's very common in women compared to men. And then you also get decrease of balance. So with a decrease of balance, they're afraid of getting up because when you get up, you're just like, whoa, what's going on? And so then that increases the risks for falls. So this is one of the biggest reasons why UTIs are very important to know in older adults, because everything, decreased functioning, decreased mobility, decreased balance could all lead to a UTI because of the urine is just sitting inside of the bladder.
Hello, my name is Jocelyn Chavez, and I'm another one of the students here at San Diego City College, and I'm going to talk about the effects of urinary tract infections and how they relate to hospitalizations. So unlike younger individuals, other individuals present other more typical symptoms in UTI, such as delirium, fatigue, weakness, and delirium is one of the closer ones that we have to monitor, and one of the most common ones. Because of these atypical symptoms, sometimes this makes it harder for these individuals to get diagnosed with UTI. So this causes a delay in the treatment that they receive and also leads to hospitalizations. Because sometimes the infection can go from the urinary tract and go into the bladder, and this is when it becomes cystitis and causes inflammation in the bladder, or it can go up the ureters and into the kidneys and the nephrons, and this can become pyelonephritis. Usually, if it comes at this point, especially in older individuals who have a weaker immune system, this can lead to hospitalization, so they can receive more critical care and also IV antibiotics. If untreated, it can become urosepsis it's when the infection continues and transmits into the bloodstream, which causes an overall inflammation in the body and the organs, and can lead to other complications such as organ failure and even death. Another risk for other individuals that leads to hospitalization is a greater risk for falls. Like it was mentioned before, such symptoms like delirium, weakness, fatigue in the older individuals can cause them to lose balance and fall. So it is important to be careful, and since this can lead to fractures and surgery. And in the hospital, catheter-associated UTIs are the most common, sometimes due to a lack of safety infection precautions, which is something that's really important to monitor in hospitals for nurses and healthcare providers as well.
Christina Noriega. I'm one of the nursing students here at San Diego City College. So I'm going to be talking about UTI prevention. One of the ways to prevent UTIs is by a good hygiene. For women, that means making sure wiping front to back, because with our anatomy, the way your rectum is very close to your urethra, and women have very short urethras. So we are very prone to getting E. coli, which is found in our gut, to enter our urethra. So that's making sure that each time we go from front to back. Another way is daily soap and water. We want to make sure that we're cleaning our peri area with soap and water every day. Making sure that we're changing our undergarments. That means that if we have voided in our underwear or our diapers, that we make sure that we change those out to make sure that we're not building any bacteria up into our undergarments. The next thing I want to talk about is urinary frequency. That means maybe planning a schedule of how often you're going. We want to make sure we're going every 2 to 3 hours, so we're not retaining that fluid that we have into our bladder and creating an area for bacterial growth. And making sure that we're completely emptying our bladder so that the bacteria is flushed out. We also want to make sure that we're always hydrated, so making sure that we're drinking 2 to 3 liters of water a day to help flush the bacteria out. Hydration is very important for us, and a lot of us as we get older forget to drink water during the day, so making sure that we stay hydrated. Another one is for men with prostates. We want to make sure we're attending our regular checkups and taking our medications correctly, because when we're not taking care of our prostate, our prostate will constrict and not allow the full release of the urine inside of us. And then making sure knowing when to call if you're seeing signs and symptoms, to call our primary health provider to make sure that we get this taken care of as soon as possible. For people that don't have connections to healthcare providers, some ways to find those connections is going to Family Health Center, where they provide free and low cost family services for people who don't have health insurance. As well, you could go to the San Diego City Medical Care for Adults online, and they connect you with those services.